That's good. Thank you so much, everyone, for joining the TNCPI webinar series this time. So this time around that we are lucky to have a fellow from Institute of Pathology, Laboratory and Forensic Medicine to talk about her area of expertise in forensic medicine. All right, so before we go on with the introduction and things, so let me introduce myself first. I'm Associate Professor Dr. Muhammad Yusmi Aidil Putra bin Yusof, one of the fellow at iPerform and also faculty member, Faculty of Dentistry, UiTM. All right. So basically that these topics entitled use of post-mortem computed tomography during the COVID-19 pandemic, the Malaysian experience. Our speaker will be Associate Professor Datin Dr. Mansharan Kaur, Chainchel Singh, one of the fellow iPerform. All right, just a little bit introduction about this particular work, right? So and Datin as well. Datin Dr. Mansharan Kaur Chainchel Singh is an Associate Professor in Radiology at the Faculty of Medicine, UiTM, and she received her Bachelor of Medicine, Bachelor of Surgery, BBS from Manipal Academy of Higher Education, MAHI, Manipal, India in 1996. A Master's in Radiology from University of Malaya in 2005, and after serving as a General Radiologist for 3 years, she proceeded with her subspecialty training in Forensic Radiology at the Victorian Institute of Forensic Medicine, Melbourne, Australia, from 2008 to 2009. She is also a fellow at the Institute of Pathology, Laboratory and Forensic Medicine, iPerform in short, UiTM, and has been providing services at the National Institute of Forensic Medicine, IPFN, Hospital Kuala Lumpur in the field of forensic radiology over the last 10 years. Her current research interests involve sudden death, looking at the association of calcium scoring and biomarkers of inflammation, genetic expression of AMPK in post-mortem samples, as well as post-mortem computed tomography angiography, PMCTA. So basically that she has vast experience in this particular research area and in particular field. All right, so and I think that she's one of the few of forensic radiologists in Malaysia, not more than 10, I think, maybe less than that. All right, so basically that yeah, it's a one, we are lucky here to listen from the horse's mouth from Datin herself to share with us her experience in research as well as her service at both institution, UiTM and IPFN. All right, so without further ado, I welcome Associate Professor Datin Dr. Mansharan to deliver her webinar talk. Please, welcome.
Thank you, Associate Professor Dr. Yusmi Aidil Putra, for that kind introduction. And a very good morning and a welcome to all participants who have logged in for this live research webinar organized by the Office of the Deputy Vice Chancellor of Research and Innovation, UiTM Shah Alam. I hope I'm audible to everyone. I hope I'm audible.
Yes, yes.
Okay, okay, thank you, Yusmi. So I'm going to start sharing my slide right now. All right, I hope everyone can see the slide presentation. This morning, I'm going to be talking about the use of post-mortem computed tomography during the COVID-19 pandemic, the Malaysian experience. First of all, an overview about what I will be speaking and sharing with you over the next 30 to 40 minutes. An introduction to forensic radiology, overview of the COVID-19 pandemic, the study that we're going to be talking about on use of post-mortem computed tomography, or PMCT in short, during the pandemic in Malaysia, the methodology, analysis, discussion, and finally a conclusion on the above mentioned study. So a little bit about forensic radiology, an introduction to forensic radiology. I think it's important for most listeners out there to know what a forensic radiologist does and how important or the use of imaging to our forensic pathologist colleagues. Because, well, in the beginning, every time I mentioned to friends that I had done my subspecialty training in forensic radiology, I always get the comment that, wow, that must be interesting. Something like CSI or bones. True and not so true, I must say. Well, forensic is always interesting, at least to me. It is like CSI and bones, except that on these TV shows, well, the actors are so good looking, the actresses are so beautiful, and they always showcase the latest up-to-date scientific knowledge and techniques used in solving a crime or a case. And of course, all of that has to be finished within the 1 hour of the show. So forensic in the real world is nothing like that. It's teamwork. Again, it's not a one-man show. So in addition to forensic pathologists, other teams like radiology, odontology, of which Associate Professor Dr. Yusmi Aidil is a member of, as well as toxicology and anthropology, all have a role to play. So forensic radiology is a specialized area utilizing the available radiological techniques to assist pathologists in matters related to the law. And of course, the use of imaging or radiology in the forensic world is not something new, as it has been documented that as early as 1896, the first radiograph was submitted to the court of law as a document, right? So why is imaging important to the forensic pathologists, right? Or how do we play a role in the forensic world? So this first image here shows a snapshot, a cropped image of a chest X-ray of an individual. Now, I'm sure most of you will be able to appreciate, or at least I hope you will be able to appreciate, that they are actually multiple fractures of the ribs here on this side, on the left side, and they are multiple dense foreign bodies or objects here of varying sizes. Now, these dense foreign objects were actually bullet fragments. So this was actually a case of a gunshot wound to the chest. So you can imagine then, even with a plain radiograph, how useful this imaging would be to the pathologist, because this would give an insight to them on what to expect before doing a conventional autopsy, right? And the image here on my right is actually a post-mortem CT image of a child, and this is a 3D image, and this is an MPR, or a multiplanar reformatted image of the same child here. So as mentioned earlier, though the use of imaging is not something new in the world of forensic, it was only after the formation of the Virtopsy Foundation, Virtopsy standing for virtual, meaning virtual and virtual autopsy, right? And that foundation, which started off in Bern, Switzerland, actually was the foundation that propelled the use of the newer imaging modalities available in radiology to the forensic world, i.e. the use of post-mortem computed tomography. All right, so this is actually a world map showing countries with available post-mortem computed tomography facilities. And as you can see out of the list that has been provided on the left side of the screen, most of them are actually countries from the West or European countries. But I'm happy and glad and proud to say that Malaysia is one of those countries with an available post-mortem CT facility. And in fact, we are the only country in Southeast Asia with that facility, and our nearest counterparts are those in Australia. All right, so a little bit about forensic radiology in Malaysia. So as mentioned before, the use of radiology or imaging in the forensic world is not something new. And Malaysia has also been using imaging over a number of years, decades, I must say. And it's just over the last 10 years that we've been fortunate enough to have the post-mortem CT facility, which is located at the National Institute of Forensic Medicine in Hospital Kuala Lumpur. Now that facility has been there since June 2010. So i.e. that means we have had 10 years worth of experience using post-mortem CT in the forensic world. This is just a snapshot to show the National Institute of Forensic Medicine at Hospital Kuala Lumpur. I assume this must be a busy day. You see a lot of photographers outside, and equally a lot of people within the compound. So I am proud to say we've had quite a number of interesting cases coming through the doors of the Institute in the past, like the Jong Nam case, the Adit case, the Kevin Morais case. And in all these cases, we actually used post-mortem computed tomography, and it was useful for the forensic pathologists. So this institute actually receives about 2,500 annual admissions. Now, when we talk about annual admissions, we're talking about the deceased, of course. So in addition to medical legal autopsies, this would, I don't know why my slide seems to be running faster than I can talk, so this includes medical legal autopsies as well as those cases of patients who have died in the ward and are brought down to be kept in the mortuary refrigerator before being claimed by the next of kin or family members. So this center does about 500 to 700 medical legal autopsies each year. In fact, I think we have, for this year, we have probably reached about 560 medical legal autopsies so far, with another 2.5 months more to go. So this here is a picture of the post-mortem CT available for the National Institute of Forensic Medicine. And of course, it must be remembered that in the living or in life, there is, it is almost impossible to have a whole body CT scan. And it's only when you're dead or afterlife that you would actually get one performed for you free of charge at the National Institute of Forensic Medicine. So there are currently 2 forensic radiologists in Malaysia. We had 3 However, one left for greener pastures, and proud to say that the first trade is from UITM. That was the story started in 2007 when I went to see Professor Dr. Hafiza Muhammad Nawawi, who was the Deputy Dean of Postgraduate and Research at the Faculty of Medicine UITM then, and I informed her of my interest to do my subspecialty training in forensic radiology. So with the blessings from my family, the Dean of the Faculty of Medicine then, Professor Dato Dr. Khalid Yusof, and the Vice Chancellor of UITM, I actually embarked on my subspecialty training from 2008 to 2009 at the Victorian Institute of Forensic Medicine in Melbourne. Now, this is my other colleague from the Ministry of Health, Dr. Muhammad Hilmi Muhammad Noor, and he's trained from the University of Maryland in the United States of America. So currently there are only 2 forensic radiologists in Malaysia, and I'm glad that I'm able to put UITM indirectly on the world map. So a little bit on COVID-19. As we know, it's caused by the severe acute respiratory syndrome, coronavirus 2, SARS-CoV-2. So why are we so worried about COVID? Of course, we must all be aware that the pandemic is far from over. And as of yesterday, there were a total of 82 new cases, which brings the number of COVID cases to a total of 10,358, with a total of 130 deaths and 9 critical cases treated in ICU. So the pandemic is far from over, and we must all adhere to rules and regulations of keeping our family and ourselves safe. And so, as we are aware of its high mortality rate and the infection rate, many countries, Malaysia included, had its own guidelines and standard operating procedures, or SOPs, in place for clinical patients, i.e. living patients who tested positive for COVID and were admitted to the hospitals. Now, this was important to keep the healthcare workers at the hospital safe. In accordance with that, one must remember that even after death, there is still a chance of contracting this virus from the deceased, and thus many countries, including the Royal College of Pathologists and Malaysia, had developed its guidelines for the use of healthcare workers in the mortuary. This was important not only to prevent the disease or among the healthcare workers in the mortuary, but I think it also included guidelines on the handling of deceased bodies, both for the health officers as well as next of kin or family members who had to perform the last rites and burial. Right, so one of the most important aspects of these guidelines for healthcare workers in the mortuary included the statement on the possibility of limiting conventional post-mortem or autopsy examinations, and if the cause of death could be made using external examination and diagnostic tests with the help of post-mortem imaging modalities instead of the conventional autopsy. So forensic imaging, which includes, as I mentioned, the use of radiographs, post-mortem computed tomography, PMCT, magnetic resonance imaging, MRI, or ultrasound, has become an integrated procedure for post-mortem investigations in many forensic centers around the world, as this allows non-invasive or minimally invasive detection of findings that may or may not be visible during a classical autopsy. So this statement is very true at the National Institute of Forensic Medicine, where every deceased with a Police 61 form, which I will show you later what this Police 61 form is all about, will have a whole body CT scan performed before the classical autopsy. And this has proven to be very helpful to the forensic pathologist because, like mentioned earlier, it gives an insight onto what to expect. So we are able to detect conditions like pulmonary TB and alert our colleagues on the hazards before they actually go in and perform the conventional autopsy. So the study was, I decided to do this study as we had data of cases coming in during the MCO, and I wanted to highlight the protocol that was adopted during the pandemic. And of course, the most important thing was to assess the usefulness of post-mortem computed tomography as an adjunct to conventional autopsy, because then this would serve to satisfy the statement in the guideline produced or provided for by the Ministry of Health, requesting or for the number of conventional autopsies to be reduced. Thus, it was very important for me at least, and I'm sure my colleague, to know if what we were doing was actually useful and not just a waste of time. All right, so this was the methodology adopted. This study was conducted within local guidelines with approval from the Ministry of Health Malaysia, and that's our National Medical Research Registry number for this study. It must be remembered that all research done at Ministry of Health hospitals, be it health clinics, tertiary hospitals, or district hospitals, must be registered with the National Medical Research Registry. So we had a total of 194 cases brought in death to the Institute from the 18th of March 2020 to the 9th of June 2020 during the peak of the MCO. I chose these dates because these were the dates when almost no, or if at all, just very limited post-mortem examination was being done, and the forensic pathologists relied heavily on post-mortem imaging to determine the cause of death. Again, it must be remembered that cases brought in during this time, either didn't have any history, or some of them were still suspicious for COVID-19, awaiting results, and died before results were actually released. So we were looking at cases which we were not sure about their COVID status. So this is the police or Pol 61 form, which accompanies the deceased and is produced or it is from the investigating officer from the Royal Malaysian Police, and it is to the forensic pathologist or medical officer requesting for an autopsy to determine the cause of death. Right. So this is the workflow adapted during the pandemic and continues to be used even till today, as the pandemic is far from over. So we start off at the top of the workflow of the chart. BID means brought in dead case. So these cases had the police 61 form, as I showed you in the previous slide, received by the staff at the National Institute of Forensic Medicine. The forensic pathologist and medical officer are informed, and they actually meet up or interview the next of kin, family members, and the police as well, the investigating officer, in order to obtain any clinical history or other pertinent information that would help in coming up with the possible cause of death. This case is then discussed with the forensic radiologist. A request form for post-mortem CT examination is filled out, and the radiographers are informed. Now, this is where it is so the initial 4 steps what we would practice even during, before the pandemic. However, after that, this is where things are a little bit different now during the pandemic, because during the pre-COVID era, just one radiographer would come down using a 3-ply mask, a simple apron, gloves, and he would handle the deceased and perform the CT examination as well. However, during the pandemic, we needed more support staff, and so 2 radiographers would be required to perform a CT examination. Reason being that the first radiographer would act as the contaminated or dirty radiographer. He dons the appropriate personal protective equipment, and he or she would be the one in direct contact with the body bag, and while the second radiographer, acting as the clean radiographer, would be stationed at the CT console and performing the CT examination. So the CT examination was done following the prescribed predetermined protocols, taking all precautions. Now, after that is done, the report is, once the images are ready, the report is then prepared by the forensic radiologist in consultation with the forensic pathologist in order to come up with the most possible cause of death, as it must be remembered that during these times, there was almost no or very limited autopsy, and the pathologists depended heavily on imaging, right? So all of this then took so it took double the time to just do one case. So the post-mortem CT scan imaging is done. The deceased is actually placed in a 2-layer body bag, and a native or a plain or a non-contrasted CT scan is performed using the predetermined and predefined protocols, covering covering the entire body from head to toe, where the slices 1 mm slices would be done for head and neck, and chest down to the toes would be done in 2 millimeter cuts. Now this picture here shows how the body bag looks like typically, with the deceased within, and the body bag is strapped. Now the reason for using the body bag is to prevent any bodily fluids or secretions from dripping onto the couch. So that's the CT scanner, that's the gantry, the couch, which would then go through the gantry, and axial CT scan images of the deceased would be taken from head to toe. Now the CT scan machine used for post-mortem CT is no different from the one clinically available for clinical patients, right? And this is just to show you how the contaminated or dirty radiographer would be dressed. You know, instead of the 3-ply mask, he or she would now be using a N95 mask, and instead of a simple apron, he or she would now be completely covered from head to toe, which made it's actually quite hot, and made life you know, a little bit difficult, since I think it was quite tiring and hot being in this outfit. So this is just to show how important it is to for the forensic radiologists and pathologists to sit in and discuss the case once the images are ready, in order to come out with a cause of death. So after the CT scan examination, the deceased would then be wheeled into the mortuary, and where the external examination would be performed by the forensic pathologist, medical officer, and this is actually performed in a negative pressure autopsy suite, biosafety level 2 upgraded, which is in accordance with the interim guidelines by the National Institute of Forensic Medicine. It was also during this time that nasopharyngeal swabs and oropharyngeal swabs will be taken for real-time reverse transcriptase polymerase chain reaction, or what we know as, in short, RT-PCR testing. And this is a picture with permission from the website of Hospital Kuala Lumpur, which shows how the forensic pathologists, medical officers, and medical assistants are dressed before the examination is actually done in the biosafety level 2 upgraded autopsy room. And as well as how the nasopharyngeal and oropharyngeal swab taking would be performed and submitted for the RT-PCR testing. So the technique of the nasopharyngeal and oropharyngeal swab is exactly as would be for the for a living or in a clinical case. However, during that period of time, it took longer than usual, anywhere between 24 to 36 hours to actually get results, the RT-PCR results back, as the labs were burdened with a lot of cases from wards as well, which took precedence, as these were clinically living patients. So what was the number of CT cases we performed? Now, if you remember in my earlier slide, I said we received a total of 194 cases from the 18th of March to the 9th of June 2020. However, only 88 28.8%, or 172 cases were scanned, and 22 or 11.2% of cases could not be scanned at that time, as there was a breakdown of our CT machine. I know it's not the best of times to have a failure or breakdown of any equipment, as during that period, technical staff were actually not available, as very few people were working, and it was not easy to get replacement equipment. This either took longer than usual or probably could not come in. Right? And so out of the 172 cases that were scanned during that period, 35 or 20.3% were females, and 137 or 79.7% were actually males. What about the number of cases we scanned by age group? Now, if you were to look at the bar chart, it's quite obvious that the majority or the highest number of cases came from the 40 to 49 age group, followed by the 50 to 59 age group, and the 30 to 39 age group, i.e. meaning most of our cases were located between 30 to 70 years of age. Now, by nationality, these were the number of cases we performed a CT on. So out of 174 cases, 172 cases, 106 were Malaysians, 28 were Asians, 28 were Southeast Asians. We had 3 from America, 1 from Africa, 1 from Europe, and 5 unknown. It's quite common to get cases of unknown identity, meaning they are these deceased are found with no documentation on them, and they are usually found dead either under the bridge, at the bus stop, or in the back alley. And of course, most of them are usually John Does rather than Jane Does. So out of the 106 Malaysians scanned, 56 were Malays, 36 were Chinese, 12 Indians, and 2 were Bumiputras from Sabah and Sarawak. All right, I know this may seem a little daunting to the non-radiologists out there, but of course, during this era, we were also hoping that we as forensic radiologists would be able to assist our forensic pathologist counterparts in determining if these cases that we scanned had any remote possibility of having the COVID-19 infection. However, we only had images of clinically living patients diagnosed with COVID-19 who had CT scans. And so we had to extrapolate these findings onto our post-mortem images to see if this is what we could see. Now, it must be remembered that most reports and research available are of living patients with COVID-19, and there is hardly any research done on COVID-19 post-mortem CT findings. I think there are just about 2 case reports performed, but nothing looking at a big number of cases for us to compare. So these are actually axial, CT, chest images of living patients, and this is in a lung window so that the lung parenchyma is better seen, and not so much to show the bone or other soft tissue. So what were the typical COVID-19 chest findings that were described in living patients? So they typically describe things like ground glass appearance. So this is what you call ground glass appearance, which had to be peripherally located. That's normal lung parenchyma. That's the vessel, i.e. the arch of the thoracic aorta, the trachea, and the esophagus. So that's the ground glass opacity described. Now, the other term used was crazy paving, meaning ground glass appearance like we typically see in this image, and distributed peripherally, but in no particular fashion. So that's why it was called crazy paving. Other signs reported were things like vascular dilatation, as seen here. This is actually a dilated vessel, and evidence of bronchiectasis, as seen in this image. So how did we fare when we extrapolated these findings onto our post-mortem CT images? So yes, we did see ground glass appearance. So these are actually axial CT images from post-mortem cases. So yes, we did see the ground glass appearance as mentioned. And here as well, that's pulmonary edema and ground glass. But what made it difficult was that we were seeing ground glass features even prior to the pandemic. So that made it a little bit more difficult for us. And furthermore, it must be remembered that patients that we received died of failure, which means the lungs looked bad. There was a lot of pleural effusion, pulmonary edema like this. So sometimes it made looking for crazy paving or ground glass appearance very difficult at times. And of course, one must remember that we also received cases of SARI. SARI, not the dress sari, but SARI, which means severe acute respiratory infection. So the lungs were really, really bad. And there was hardly any normal lung parenchyma left at times for us to come out with a diagnosis of COVID, if possible at all, from our post-mortem CT images. So these were the number of cases that a PMCT was performed, and we determined the cause of death. Well, at least that's what the radiologist felt the cause of death was due to. So in 96 cases, we attributed the cause of death radiologically to a cardiac or a heart-related cause of death, in a sense that we actually saw very bad coronary artery disease or arteriosclerosis. In 61 cases, it was actually the cause of death was actually attributed to a respiratory cause, and that also included pulmonary TB. In 34 cases, it was attributed to a head, neck, or brain injury, as it must be remembered that during that time, we had a lot of cases of fall from height, i.e. these were actually patients who committed suicide. Now, I think the most important aspect of this study is actually to look at the agreement between the report produced by the forensic radiologist and a certified cause of death report produced by the forensic pathologist, because that would then show or determine the usefulness of PMCT or postmortem CT imaging during this pandemic. I mean, after all, I think that would be the sole purpose for the PMCT during this pandemic. I'm happy to say that in almost 90% or at least 87% of cases, both the radiologists and forensic pathologists agreed that the cause of death was respiratory related. In about 80% of cases, we agreed it was cardiac related. And in almost 75% of cases, we agreed that it was related to an injury or lesion within the head, neck, or brain. However, in about 90% of cases, we could not determine the cause, as we received quite a number of decomposed bodies as well, which makes PMCT imaging difficult, because by then there's too much air within the organs, and it probably would be useful just to look at the bones, the fractures. So in conclusion, although I must say that post-mortem CT imaging was not superior and probably will never be superior to the molecular testing done or performed at the diagnostic labs, the reports the forensic radiologists produce has been beneficial in assisting the forensic medical officers and specialists in certification of a cause of death. And indirectly, this helped avoid infection within the forensic fraternity, as the number of conventional autopsies were reduced. Thus, I believe, in conclusion, that virtual autopsy or post-mortem CT imaging will be the way forward in the future, especially during pandemics, as it is a complementary to conventional autopsy. I mean, this has already been proven where post-mortem CT imaging has been useful in disaster victim identification. So thus, I'm sure post-mortem CT imaging will also be or has proven its usefulness during pandemics. Last of all, I would like to thank the following persons at the National Institute of Forensic Medicine Hospital Kuala Lumpur, without which this presentation or study would not have materialized. Dr. Muhammad Azaini bin Ibrahim, the director at the National Institute of Forensic Medicine Hospital Kuala Lumpur, my colleague, Dr. Muhammad Hilmi bin Muhammad Noor, Mr. Lai Po Soon, the forensic science officer who helped me retrieve data for this webinar. And we're also hoping to come up with a full manuscript, as well as, of course, support staff. These are the forensic radiographers, without which I would not have an image to read or look at, and obviously no data to present. With that, I thank you for listening, and I believe we have time for at least 5 to 10 minutes for any possible Q&A. Thank you.
Well, thank you, Datin Mansharan, for that wonderful talk on autopsy and PMCT. I'm sure that that's going to trigger a lot of interest out there, to venture in this field as well. Well, heartfelt thanks and congratulations to Datin Mansharan for your wonderful service to the country and achievement, respectively. Right, with only 2 forensic radiologists to serve the entire nation, well, I'm sure that both of you are working around the clock for any given post-mortem autopsy. Well done, and thank you so much for your service. Right, well, I guess that we have time to ask questions. So basically, before I forget that, I would like to remind all participants to please fill out the feedback forms given by the secretary in the chat box. So basically, if you can do that, thank you so much. All right, so if you have any questions, perhaps that you can just switch on your mic and just ask directly to Datin Mansharan, or perhaps that I can read it out from the chat box. If you can place your questions there, I can just read it out loud. All right, so perhaps that while waiting for that, Datin Mansharan, well, I do have questions for you. Well, okay. Now that my question is that with the accessibility of the virtual autopsy and PMCT in most forensic centers, do you foresee any benefits of the traditional autopsy in future?
All right. Yeah, thank you, Associate Professor Dr. Yusmi Aidil, for that question. That has been a burning question, actually, over the last 10 years, because, forensic pathologists probably feel, are they still going to be required in the near future? Well, actually, forensic radiology is not there to take away what a forensic pathologist would do, because the thing is, forensic radiology is probably useful in certain conditions, like, for instance, motor vehicle accidents, fall from height, where we are probably better looking at fractures, bleeds, free air. But the forensic pathology is still very much needed, and I don't think we would be going away from doing a conventional autopsy, because you would still need to take biopsies and tissue for histopathology examinations. Though, of course, in Sweden, even that, sometimes it's done by the VertoBot, which is a robot that takes the specimens. But I don't foresee that problem yet, because the VertoBot is only being used in Switzerland and most other countries which have post-mortem CT facility on board still perform a conventional autopsy after the post-mortem imaging. So the post-mortem imaging really there is to guide the forensic pathologist on what he or she would expect when he or she does the conventional autopsy.
All right, thanks so much for the wonderful answer as well. So yeah, at least now I know that what to expect later in the future. So hopefully that we don't cut any jobs. Because we know that with technology, especially with artificial intelligence nowadays, that there are a lot of jobs that can be cut or something like that. But the thing is, we know for a fact that actually that the traditional or conventional autopsy is still needed in the future, because we still need the hard evidence in terms of the autopsy, the soft tissue, hard tissue, and so on and so forth. All right. Well, okay then. So I guess that's all. That you've received a lot of compliment here, Datin. Right.
All right.
So very informative, very inspiring by Dr. Azia and Dr. Siti Zulina as well. So very an eye-opener as well. Well, actually it is true that it's an eye-opener for me as well, although I'm a forensic odontologist. But the thing is that we hardly work on the PMCT. Well, I guess that's something that we can
work together on.
Yes, work together on that. Well, yeah, I think that that concludes the webinars for today. Well, thank you so much, Datin Mansharan, for your wonderful talk. All right. Now, on behalf of iPerform and the NCPI, thank you again, and hopefully to see all of you again.
Thank you very much to all the listeners out there and the wonderful comments. Thank you.
Thank you. Bye.